This video was made on Ngunnawal country, and we acknowledge elders past, present and upcoming. Aboriginal and Torres Strait Islander viewers are warned this video contains images and voices of deceased persons.
It's the place where you come to make your life better, you know, what life you've got left. It makes it a whole lot better and easier for you, and I think you'll find yourself happier.
When someone is getting towards the end of their life, some important things need to be talked about. This video is about palliative care, what it is and how it can help our mob.
The cultural competency of the facility.
You know, they're not going to be able to do things later down the track. They've got that say. They've got those plans in place. They know what's happening. So I would say to another palliative patient being referred, this is going to be your chance to have what you want.
Palliative care is about the patient having their say. Whatever the life-limiting illness, you can meet your palliative care team so they can hear your story and understand how you wish to be cared for.
One of the things that I want to tell you is that we have a very comprehensive service here. So we look after you at home.
Palliative care is about planning the time you have left. And for Chatty, that meant making a video about palliative care for his mob.
Quality of life and dignity. You know, this is where you need to be. To give you that opportunity to spend the rest of your life, or whatever time you have got left, knowing that it is an unstoppable disease that they haven't found a cure for yet. But in the meantime, if you want to live that bit extra longer, I really encourage my mob within the Ngunnawal country, you know, just to give it a go and see how you like it.
That's great. Yeah.
Okay, and one more. That's it, mate. Well done. Just widen your stance a little bit, about shoulder width apart. Here we go.
Palliative care can support our mob in the hospital, the hospice, and even at home.
A lot of people think palliative care is about death, but it's not. It's actually about optimizing life.
Chatty was a person that knew what he wanted. So even in the time of his suffering, he was a very good communicator. And that was an advantage to him once he made that initial engagement with palliative care, once we broke down that huge barrier. So we created this support around him to listen to him and meet his needs as best as we could, his physical needs, the equipment he needed, the physio that he enjoyed, the cultural support of Wonunga and the ALOs. And so that created a solid platform of specialised care. And I think he recognised that.
Yeah, keep talking. And I think because Uncle Greg...
Palliative care continues during Sorry Business. If it's helpful, trained staff can visit your home. The relationship is ongoing because palliative care is holistic.
If somebody's got a life-limiting illness, looking after their physical, psychosocial and spiritual well-being, as well as doing bereavement care and looking after their loved ones after the patient passes away, is all what palliative care is. It's a very holistic field.
So I see the negative thing without having that care in place, and I've seen the positive things with, you know, having all the care that Chatty had. So I think one big thing with Aboriginal and Torres Strait Islander people is making sure, you know, they know those services are out there, because a lot of the time we like to look after our own mob, and that's a big thing for Aboriginal and Torres Strait Islander people. We think we can look after them, that's okay, we don't need anyone. But really, having all those supports in place will help us to support them. You know, I took the approach with any palliative patient, and that was empowering their families to look after the patient, so then they feel that sense of accomplishment.
From my experience with motor neuron disease, with the time that I got left, I only wish that I would have come here earlier. Instead of sitting at home, suffering in pain for the last 2 years, knowing that it wouldn't have stopped the progress of my disease, but at least having that dignity and quality of life without the pain and suffering.
once he understood palliative care, out came all these goals that he wanted to kick, and he ticked them off. And he was doing that really up until he died.
Chatty's story shows what palliative care is and how it can help our mob. How it helps patients have their say, plan the time they have left, get support at home, help both the patient and their family, and continues to help even during sorry business.
You know, delaying that referral, I think when it's the end of the life journey, they can end up in the emergency department, where it could be very scary, lots of things happening, lots of busy people around, and you're not allowed as much family, you don't have those plans in place, is probably not the best place to pass away. So if you've got that palliative care involved, you've got that care plan, and you've got the place where you want to pass away on your terms.
For further information on palliative care, please discuss with your chosen health professional or check out these websites.